I'll just give a brief overview of the glymphatic system and some of the work that I have been part of, especially the large mammal studies and also the proposed human studies that I'll be talking about, and also an overview of neuroimaging modalities that are currently being used to investigate this system in humans, and some preliminary study plans for discussions. So the glymphatic system is the concept was first developed in rodent models. It holds that the CSF or the cerebrospinal fluid has a directional flow within the central nervous system. So it transports the endogenous solutes and exogenously administered compounds within the brain at speeds exceeding the limits imposed by the simple diffusion which happens in the brain. So basically, it's a fluid transport system that facilitates the influx of the CSF into the CNS interstitium. It shows the influx of the CSF in the periarterial spaces. We know the CSF is in the ventricles. It gets transported along the subarachnoid space. And the glymphatic concept is basically, it says that it goes along these periarterial spaces here. And then it gets exchanged with the interstitial fluid in the brain parenchyma. And this is primarily mediated by water channels, the aquaporin 4, which are present at the astrocytic end feet. So this fluid gets exchanged with the ISF along these aquaporin 4 channels. But recent studies have explored a lot more mediators, which kind of mediate this process. So after being exchanged with the interstitial fluid, the solutes or the metabolites goes along the perivenous spaces for the efflux. And from here, it's basically carried out. Some part of it is drained into the meningeal lymphatics, which is another newly discovered system, part of which also acts together with the glymphatic system. And the others will also be absorbed into the arachnoid granulation, which is like an old age concept that has been described in the textbooks. And ultimately, it gets drained into the systemic lymphatic system. Like in the panel B, here you can see schematic, which shows the efflux of the CSF, for instance, along these perineural sheets of the olfactory axons, the cranial nerves at the skull base, and also along the spinal nerves. And ultimately, they drain into the cervical lymphatic system and then to the bloodstream. So the core aspect of the glymphatic transport is that the influx and the efflux of CSF tracers, which we use to study the system mainly in the rodents, and even some tracers that can be used in humans, they are normally suppressed in awake state. But the increase in natural sleep and under certain kinds of anesthetic regimens, which promote the brain clearance of these neurotoxic metabolites like amyloid-beta and tau. So this is a schematic which shows the arterial pulsations in the brain drives the perivascular space CSF flow. So here basically you can see CSF solute and the arterial wall motions kind of drives this perivascular CSF flow. And then it gets exchanged along these aquaporin 4 channels, which are on the astrocytic end feet, and also along these astrocytic gaps. And then is exchanged to the interstitial fluid. So the arterial wall motions play a key role in mediating this CSF-ISF exchange in the perivascular space CSF flow. And the initial studies showed that if you delete the aquaporin 4 in mice, this influx of the tracer, which is shown in green, is significantly reduced. So that study kind of proved that aquaporin 4 as a key mediator, like a molecular mediator in driving this CSF influx. In 2015, the lymphatic system in the meninges were discovered in the rodent CNS. And since then, there have been like several studies which have looked into the neuroimmunological modulation of the lymphatic system in immune cell crosstalk in several neurological conditions. And during aging, the lymphatic system is like functionality is reduced. So the clearance of this metabolite is significantly reduced. And this could be like a risk factor for conditions such as Alzheimer's or Parkinson's, where you have like an enhanced kind of deposition of these abnormal proteins like amyloid or alpha-synuclein in the brain, which are not adequately cleared from the CNS. And apart from the lymphatic system in the brain, there is also a similar system which is in the ocular compartment in the eyes. So in this schematic, you can see this is a brain lymphatic system. And as I said, one of the efflux is along the perineural sheaths of the cranial nerves. And the subarachnoid space that is here, where the CSF is flowing, is also in continuity with the subarachnoid space of the optic nerve. And this has been extensively studied in conditions such as glaucoma, where you have like an increase in the intraocular pressure, which can affect the CSF flow along the optic nerve. And this also has implications in astronauts who experience uh, optic disc edema, which has been shown to affect the CSF flow. So this is basically a schematic where you can see the subarachnoid space of the cranial compartment is in continuity with the optic nerve. So the flow is directionally driven from the intracranial subarachnoid space to the orbital subarachnoid space. And there have been several studies which has looked into this, and also from a clinical perspective in patients with the glaucoma and also in astronauts with the optic disc edema, where the lymphatic system could play a role in mediating all the CNS changes that happens in microgravity. So this is a clinical study where you can see in a patient with glaucoma, this is a control condition where you can see the CSF along the optic nerve, the flow which is significantly impaired in glaucoma. And studying the ocular lymphatic system could be like a prognosticating factor in CNS disorders as well as in systemic disorders, because it could be studied in a very non-invasive manner, and it's like a downstream compartment of the main lymphatic system in the brain. So some of the physiological drivers which modulate the lymphatic function are outlined here. One being the cardiac cycle, because we know during the systolic phase of the cardiac cycle, the brain and the intracranial vasculature expands and compresses the lateral and the third ventricles. And these motions kind of force the CSF flow in a craniocaudal manner. Second is the respiration. During respiration, especially during forced inspiration, you have the venous flow, which is going from the head. It is increased towards the thoracic cavity. And to counterbalance this, the CSF moves up into the cranial cavity towards the brain. So some of the meditation paradigms and breathing exercises like they focus more on the respiratory, like they focus more on the respiration, like the forced inspiration and the expiration. So this kind of movement of CSF, it could contribute to the flushing of the perivascular spaces from these metabolic ways. So respiration plays a key role in mediating this CSF flow. Third is the neural activity, which is, I mentioned, like the glymphatic function is more active during sleep, the non-REM phase of the sleep. One of the reasons that they have shown is there is reduced noradrenergic drive during sleep. And this is an important feature of the deep non-REM sleep. And this has been associated with a high glymphatic influx because it decreases the resistance to the interstitial fluid flow by enlarging the interstitial space volume. So here you can see during awake state, you have a reduced extracellular space volume, while during the non-REM sleep phase, it's markedly increased. This kind of helps in flushing out these metabolites and the toxins more efficiently in the sleep phase. And people are now targeting the sleep cycle to promote the slow wave sleep with increased delta oscillations to promote glymphatic function. The fourth is, as I mentioned earlier, is arterial pulsations. Cerebrovascular pulsations, they drive the perivascular CSF flow. And this has been shown and studied well with correlating it with the bold signal. So this was a study that was published in Science, which showed sleep to drive the metabolic clearance, the metabolite clearance from the rodent brain. And this schematic just shows that during sleep, you have an increased percentage of the brain tissue which is perfused by CSF. So there is a better CSF flow and effective clearance of these metabolites compared to the awake state. And this is a very recent study from the Finnish lab, which explored the human sleep, promoting these brain-wide vasomotor and respiratory pulsations. So they studied subjects using MR encephalography method, which is basically fMRI-based technique, but this technique can sample very low frequency pulsations. We'll come to this in a bit. And similar to sleep, anesthetic regimens have a similar effect in like inducing a sleep-like state. And this was the first study where they showed that the rate of glymphatic influx can be correlated to the prevalence of high EG delta power and also to the low heart rate variability. And here they have used several different anesthetic regimens, and they showed that a cocktail of ketamine and xylazine, it induces almost like a sleep-like state with an increased glymphatic influx compared to isoflurane. And a similar paradigm was also studied in dexmedetomidine, which is like an alpha-2 adrenergic agonist. And it also induces a sedative state similar to the stage 2 and 3 of the non-REM sleep. And as I mentioned about the arterial wall motions, this rodent study explored whether hypertensive mice would have a better or a worse glymphatic or a perivascular CSF flow. So this was a 2-photon study which explored this question. So the top panel is a normotensive mouse, which has been subjected to the 2-photon investigation using a closed cranial window. And this mice has been injected with fluorescent microspheres, which can be tracked. So all these are tracking parts of those microparticles injected into the CSF space. If you see here in the hypertensive mice, the particle tracking or the velocity is markedly reduced. And one of the reasons could be during hypertension, you have stiffening of the vessels, which could impair the CSF-ISF exchange. So basically, these wall motions kind of pump CSF in the perivascular spaces. And preclinically, there have been several modulations or manipulations of this glymphatic system to enhance drug delivery to the brain. One of them is a sleep architecture.
Hey, Nagesh.
Yeah.
So just a heads up, you have 15 minutes left.
Okay, sure. Yeah. So maybe I can just go to the clinical part of it. So the sleep architecture, which can be explored while when you can increase the slow wave oscillations to improve the glymphatic function, and also the plasma isotonicity, where you can alter the osmolarity of the CSF in such a way that you create a gradient between the blood pool and the CSF pool, and you have more of the drug getting into the CSF space. And the adrenergic system is you you deliver adrenergic agonist to mimic like low noradrenergic drive and enhancing the drug delivery to the brain. You can just skip this one. This is another study which has investigated the role of lymphatic system to play a role in the early cerebral edema progression. So here they looked into acute ischemic stroke. And in this schematic, you can see when you have a vascular occlusion, there is vasoconstriction, which results in increase in the perivascular CSF volume. And this increase in the CSF along the perivascular spaces gets into the brain parenchyma, initiating this early brain swelling. So coming to the human side, the lymphatic system do exist in humans, and this has been investigated quite recently using a contrast-based MRI, wherein you inject intrathecal gadolinium in a certain patient population and study the dynamics of the gadolinium enhancement in the brain over time using T1 mapping. And the lower panel is using a radionuclide tracer, is like the technetium 99 DTPA, and using SPECT-CT to assess the enhancement in the brain. This is an overview of how the gadolinium is enhanced in the different brain regions over time. So it's an intrathecal administration of gadolinium, and then you do like longitudinal T1 mapping to see where and how the enhancement is getting into the brain. This is a similar enhancement, the temporal enhancement of the gadolinium as early as 2 to 4 hours up to 24 hours. Similar to the rodent meningeal lymphatic system, there is dural lymphatic vasculature in human dura, which is the outermost covering of the brain. And this has been not only studied ex vivo in histopathological way, but also in vivo using two different gadolinium-based contrast agents. And similar to rodents, you see the localization of these lymphatic vessels along the major venous sinuses. Like as you can see here, this is a pre-contrast image. This is post-gadobutrol. This is the magnified view, lymphatic vessels along the superior sagittal sinus. And upon this intrathecal administration of gadolinium, one can also see the efflux of the gadolinium into the periphery, into the cervical lymphatic system, as we see in rodents. And this has been studied using the T1 mapping over time, the evidence of tracer in the cervical lymphatic system. So I'll just give an overview for the next few slides. So we have been successfully establishing this porcine model to study the glymphatic pathways, because it's like a bridge between the rodent and the human side to have like a large mammalian model to study the glymphatic system. And so we published recently this study, and this is just a video to show we do intracisternal catheterization in the pigs, and you see the pulsatile CSF containing the fluorescent tracer. And this we have been carrying out to investigate the glymphatic, the perivascular CSF tracer flow more in vivo approach by employing this cranial window technique. So this pig has been injected with the tracer shown in green. So the dura is excised, but the arachnoid membrane is intact. So you can see the ballooning of the membrane, and these pulsations are driven by the cardiac and the respiratory cycle. This is the sulcal region, and the pulsations are driven by cardiorespiratory cycle. This is currently underway to optimize the technique. And this is a clinical study which we did at the 7 Tesla MRI in Lund, wherein we assessed the CSF flow in healthy volunteers, because although it's not a direct measure of the glymphatic function, it tells you how much of the CSF is being produced in the ventricles and goes down along the fourth ventricle, and it's more like a proxy for the glymphatic function of how much of the CSF is being produced and goes down to the downstream compartments of the glymphatic pathways. And this is a recently funded project. So I got this funding from the European Association of Neurosurgical Societies to investigate the fate of the glymphatic system in mild traumatic brain injury. So we'll be recruiting athletes who have suffered from concussions from the Ice Hockey League Foundation in Sweden, and we'll be doing a non-invasive MRI in these athletes to study some of the substrates of the glymphatic system. So just a brief overview of some of the currently used neuroimaging modalities to study the glymphatic system. So most of these are non-invasive way, except for the bottom one, which involves introducing a tracer into the CSF space. So basically, this is a CSF flow quantification along the whole ventricular axis. It has been widely used in patients who have CSF disorders, where you have like a blockade in one of those ventricular axes, and it can be done at the clinical scanner. And this is again from another study where we looked at the correlation between the CSF flow and the cerebral blood flow. And we show that the CSF flow kind of correlates very well with the blood flow in the internal carotid artery. Because it makes sense, because ICA is one of the main arterial flow contributor to the brain. So if you have like an impaired ICF flow, the subsequent flow along the CSF, along the perivascular spaces, would also be altered. And this is one of the most widely used technique as of now, which looks into the perivascular space volumetry using T1, T2 weighted imaging. And also if you couple this with DTI, you can measure the diffusion along these perivascular spaces. The pulsatility is another parameter which can be assessed non-invasively This is from our optimizations where we get these 4D angiograms of the circle of Willis, and then we measure the blood flow and the velocity and derive pulsatility index. This is quite recent, which uses T2 FLAIR imaging to delineate the CNS lymphatic network along the venous sinuses, along the perineural spaces, along like the cranial nerves, and you can track it down to the cervical lymph node. This is the brain pulsations, which I mentioned, which is like an measures ultra fast, the very low frequency pulsations using MR encephalography. So these are like the cardiac impulses, so like 0.8 to 1.2 hertz. So the concept is the cardiac pulsations, in part, they pump the CSF from the periarterial spaces through the extracellular tissue into the perivenous spaces. So the MBREG detects like these three types of physiological mechanisms, which are driven by the cardiac, the respiratory, and the brain vasomotion. So the cardiac pulsations are more like periarterial origin, which extends like centrifugally, while the respiratory is more like centripetal periodical pulsations. And the very low frequency are the brain vasomotion. This is another technique which has been studied by the Finnish group using the near-infrared spectroscopy, which allows one to identify like the CSF volume fluctuations below the skull. And the last one is an invasive approach wherein you inject intrathecal gadolinium and you do longitudinal T1 mapping over time to see how this gadolinium is being enhanced in the brain, and also how much of the gadolinium is being effluxed from the brain to the periphery. For instance, in this study, they have assessed the levels of gadolinium in the blood. So it tells you a measure of the glymphatic clearance. So I'll just go through this quickly. Some of these parameters are still unexplored from a glymphatic perspective. So the effect of like altered consciousness or how meditation influences the glymphatic system or the CSF flow, and how these both are like interplayed. So this is something which hasn't been explored, and how different anesthetic regimens affect the glymphatic system has been investigated extensively in rodents, but from human perspective, it's still unknown. So these are some of like outgoing questions or points that I would like to outline here, like effects of meditation, like anesthetics, psychedelics, how would they affect the brain fluid dynamics, especially the cerebrospinal fluid, and whether the CNS lymphatics, they undergo any kind of plasticity during these paradigms, and how would the glymphatic system behave in disorders of consciousness like severe TBI, or like coma, or even near-death experiences, and whether we can ascertain a neuronal basis for the glymphatic function by studying these disorders of consciousness. And from a microgravity perspective, although there has been like recent studies published which looked into the perivascular space volumetry, which is altered after microgravity, but still there are certain other parameters that are yet to be like studied. And I think this point was addressed during one of my previous meetings, whether the creating a low adrenergic, noradrenergic drive in these astronauts would help in like a countermeasure for some of these CNS dysfunction which they experience. Yeah, this is something, another area that hasn't been investigated, whether certain neuromodulation paradigms like uh, transcranial magnetic stimulation or direct current stimulation, would it have an influence or would it alter the lymphatic system? Yeah, I think it's the same. Let's skip this. Yeah. Some of the parameters of the lymphatic system which has been explored in terms of enhancing the drug delivery to the brain has been extensively studied in rodents, but can we use the same in humans? They can be. These are some of the paradigms which are currently investigated and which have shown to play a role in enhancing the slow wave sleep. For instance, the photomodulation, which employs a near infrared light using the transcranial approaches and also the intranasal probes, which shines light and it affects the brain fluids. Whether this would have an influence on the lymphatic system is currently like ongoing. This is pretty recent, wherein groups in US are developing this transcranial electrical stimulation coupled with high density EEG to so basically they kind of the main motive of this paradigm is to switch the gears like during sleep to promote the slow wave sleep paradigms and like help eliminate all these toxic metabolites from the brain. So I think I'll skip this and I'll end with this and happy to take any questions. Yeah, thank you for your time.